Okay, okay. So, hi, evening friends, evening everybody, bache, evening everybody. I guess we know each other pretty well. I'm Dr. Sushant Soni, MBBS MMC, MD Pathology, Resident Hemato-Oncology, AIMS Daily. So, let's start with our next session, that is microbiology PYQs. In this session, as you said, I'll take care of few points with respect to systemic pathology also. हम लोग फटाफट से will cover lot of content in this session. So let's start as usual. Keep on giving me answers. It's a live session, it's very interactive. So जिसके भी तुम answers देते रहोगे, I'll hi evening Libra, evening Gautami, evening everybody बच्चे, evening Tanvi. So let's start with our first question. Mycology, evening Ada, evening dear. Mycology is extremely important. Two topics that we are going to get with respect to, we expect more questions from mycology and parasitology. Baki, do not spend too much time going into the nitty gritties of systemic bacteriology, this that, not at all. So let's start with this. Yeast is no. Nikita Kashyap nahi bache. You very well know that we divide fungi into 3-4 categories, which is Cryptococcus is the yeast na. Candida is yeast like species. Remember, we divide fungi into 4 categories, that is the yeast, which is Cryptococcus, yeast like, that is Candida albicans, which has pseudohyphae also, presence of pseudohyphae, recent INI PYQ. Molds, which is the presence of long branching filamentous fungi, Aspergillus, Rhizopus and Penicillin. These are the molds. Aspergillus in turn shows the presence of acute angle branching. It has, all these are recent PYQs. It has classical acute angle branching, that is Aspergillus. Rhizopus and Penicillium are also molds. And very important, the presence of dimorphic fungi. They show two forms, that is they appear yeast forms at 37 degrees and mold form at 25 degrees in culture. Dimorphic, there are two forms, yeast at 37, mold at 25. Which are the dimorphic fungi? Please have a good look at this list. Dimorphic fungi is important. They are Histoplasma capsulatum, Histoplasmosis, Histoplasma, Coccidioides, Paracoccidioides, Blastomyces, Sporothrix and Penicillium. Very important list. When we talk of gardener having a thorn prick injury, or just a gardener in which there are presence of vesicles along the drainage of the lymphatics, then what is the answer? Suppose these are the options given. You have a history of a gardener with rose thorn prick injury having vesicles and blister along the lymphatic drainage, that is Sporothrix. Agreed. Next, so yeast was Cryptococcus, Candida species is yeast like. नेक्स्ट क्वेश्चन अब थोड़ा सा ठीक से पढ़ेंगे. You have a history of a young child, Sporothrix. Agreed. Got me, agreed. Next, you have a history of a young child reported to fever clinic with step ladder pattern. Whenever we talk of step ladder pattern, we are talking of typhoid. That is, he has fever, frequent stomach ache and vomiting. Enteric fever was suspected. Which is the best investigation to be performed immediately? So, with respect to typhoid, blood culture. Agreed. Got me, Kashyap. Riya बच्चे गड़बड़ हो गया, Riya no. देखो, easy to remember, Gitanjali agreed. Easy to remember, Basu, that is blood culture. Vidal is antibodies. Stool culture, urine culture, to be performed in first week, second week, third week and fourth week. So the answer in this case being blood culture. Plain and simple, Basu. For typhoid, Basu. Next question. Next, very simple straightforward question. Aprajita agreed here. Basu was our simple mnemonic. Cross infection is in hospital is best prevented by. Cross infection means infection from one patient to another. Acha, recent, I think last time's NEET MDS PYQ was with respect to nosocomial infection. Nosocomial infection is infection that is occurring within what time period? I'm waiting for your answer on these two questions. Firstly, cross infection. Secondly, nosocomial. Nosocomial infection time period. That was the question that was asked. Just a second. Yes, now everything is working fine. Agreed, less than 48 hours, and this is with respect to proper hand hygiene. Agreed. So hand hygiene, proper hand hygiene prevents cross infection. Nosocomial infection, the time period associated, Kashyap nahi bache, Libra Tanvi agreed 48 hours. Bache 48 hours. Other 72 nahi. We cannot change this answer. This was last time's NEET MDS, less than 48 hours. Thamral agreed. So you appraisal marked 72, nahi 48. 48, this was recent PYQ. Next point, IgE mediated histamine release. I need not even ask you this, that it is type 1 hypersensitivity. So tell me the answers with respect to this line. Which is the main cell associated with type 1 hypersensitivity? Main cell. You already know type 1 hypersensitivity is IgE mediated response. It is associated with atopy. Fair enough. Tell me the hypersensitivity reactions with the other three conditions. Next, tell me the नहीं नामी नहीं I took a bath यार, मैं रोज नहाता हूँ. अच्छा, you do not know Hindi. This is the camera and the lighting is not proper, so you are not able to appreciate that. Nami, that is for you, dear. Main cell is mast cell. Main cell is mast cells, followed by which leukocyte increases in peripheral blood? Eosinophils. Eosinophils, basophils, and T cells. So recent PYQ, cell associated with type 1 hypersensitivity is eosinophil, basophil. Cell associated with type 1 hypersensitivity is T cell, B cell, plasma cell, NK cell. Answer to be marked was T cell. Next, type 2, 3, 4. Agreed. This is autoimmune hemolytic anemia. Recent PYQ, autoimmune, antibody against self-antigen, antibody mediated hypersensitivity. Serum sickness. This is the classical disease with type 3 hypersensitivity, contact dermatitis, which is occurring because what comes in contact with skin? Poison ivy. Poison ivy is a shrub growing in the west. Poison ivy in contact with skin, contact dermatitis. Next, Acha, I know I'm going slightly faster today. In case anybody wants me to repeat any point, please do not hesitate to say that. I mean, we know each other very well, so ये तो मुझे बोलने की ज़रूरत नहीं है. Next question, stain used for mast cells. Next question, main cytokine associated with activation of eosinophils. Next, main cytokine with activation of basophils. This line itself has been asked 2 to 3 times with respect to type 1 hypersensitivity. Stain used for mast cells. TB बचे, toluidine blue. नहीं, आज कोई party नहीं है. No party today यार, Naveen, no. I mean, yes, life is good and happening, but not to that extent, na. Today तो sleeping alone. No double meanings to that. Main cytokine associated with activation of eosinophils. Nami is in a happy mood. She distracts us so well. Acha, one more thing. We have our exclusive Zoom session on this Sunday. I have lots and lots to talk and discuss with you. So we will be joining at 8 p.m. and path and micro, what we'll do is 8 to 8:40 we will do path. We'll have a 20-25 minute break so that you have your dinner, and then we'll do micro. So next, main cytokine for activation of eosinophils. Other agreed bache. Interleukin 5. A, B, C, D, E. E is the fifth alphabet, no? Interleukin 5 followed by 4. Versus main cytokine for basophils, interleukin 3. B is the second alphabet. Interleukin 3 followed by interleukin 4. So overall, which is the main cytokine for type 1 hypersensitivity? You very well know that the main mediator associated, histamine. So main mediator, histamine. Suppose you get a question, a 16-year-old girl goes to park, gets bee sting injury leading to anaphylaxis like reaction. Main mediator associated, histamine. Next question, 8-year child who is a known case of atopy while having seafood gets laryngeal spasm. It is IgE mediated response. You can be given such clinical history based questions. Next, main cytokine with type 1 hypersensitivity. Interleukin 3, 4, 5. What will we mark? Sort of interleukin 3 nahi. Main cytokine. See, all three are the cytokines with type 1 hypersensitivity. Interleukins 3, 4, 5, they play a role in type 1 hypersensitivity. Which is the main cytokine associated? Interleukin 5. Because, no, sorry, you don't have to say sorry. Come on. Interleukin 5. Interleukin 5, because the main leukocyte is eosinophil, that is interleukin 5. Now that we are doing cytokines, tell me acute phase reactants. Tell me which are the acute phase reactants, that is which are the cytokines which play a role in fever. Most potent pyrogen, interleukin 1, followed by interleukin 6, followed by PGE2, prostaglandin E2. This was recent NEET PG PYQ, can be asked in your paper. Main role in sepsis, I'm waiting for your answers on this. Main role in ARDS, main role in COVID-19 ARDS. Next, which are the chronic cytokines? Chronic cytokines, that is, they play a role in activation of macrophages. And lastly, which are the anti-inflammatory ones? Anti-inflammatory, I think, was asked this time in INI paper also. You usually get a question on cytokines, whether it is INI or the NEET PG exam. Fever. Interleukin 1 followed by 6 followed by PGE2. Agreed. Main cytokine associated with sepsis. Sepsis. Answer bache. Main cytokine with sepsis. TNF alpha. Tumor necrosis factor alpha. TNF alpha. Main cytokine associated with ARDS. When we say ARDS is acute respiratory distress syndrome. Prajita agreed. COVID-19 ARDS is interleukin 6. So until COVID-19 is not mentioned, you will not mark it interleukin 6. ARDS has many causes. Main cytokine for ARDS being interleukin 8. Interleukin 8. Agreed, got me, both your answers were right. Chronic cytokines, that is, which play a role in activation of macrophages. Which is the main cell of chronic inflammation? Macrophage. So cytokines which cause activation of macrophages, there are 3. That is interleukin 2, interleukin 12 and interferon gamma. Interleukin 2, 12 and interferon gamma. And lastly, which are the anti-inflammatory cytokines? This time's INI PYQ. There are 3 main anti-inflammatory cytokines, which are interleukin, I'm waiting for an answer on this, interleukin 10, TGF beta, transforming growth factor beta, TGF beta and lipoxins. Interleukin 4 and 6 are both pro-inflammatory and anti-inflammatory in nature. So which was not anti-inflammatory? Interleukin 1. That was the answer to be marked. Another point to be noted in this on this slide is these 3 options, TNF alpha, interferon gamma and TGF beta, are usually given together. So bache, do not get confused with these 2. 4 name got me, not 4 bache, because interleukin 4 and 6 are both pro and anti-inflammatory. So we will not write interleukin 4 with anti-inflammatory exclusively. Next, do not get confused between TNF alpha, interferon gamma and TGF beta. They have 3 separate rules. This was with respect to cytokines. Main cytokine with type 1 hypersensitivity, interleukin 5. Main cytokine with type 4 hypersensitivity. Type 4 hypersensitivity are the chronic inflammation, interleukin 2, 12, interferon gamma. Next point. So next is yes, F7 is anti-inflammatory, I agree, but not the other variants. Aprajita, that is for you, dear. Next, which of the following is not a dimorphic fungi? With respect to mycology, recent PYQs were all on dimorphic. Remember, we made that list of dimorphic, and you very well know that Cryptococcus, I need not even ask you this. I am pretty sure that all of you will be comfortable that Cryptococcus is yeast. That was the first question that majority of us went wrong in. Yatish, if you go, acha, Cryptococcus, ठीक है, D was right. Agreed. I thought you went wrong in that question. Acha, next point, an important topic. Conjugation, transduction, transformation. A very, very important topic. We expect, though I had given you the PDF of this, especially the live class students, but let's quickly see this. Let's quickly see this in 2 minutes. In bacteria, transmission of DNA via formation of sex pili. When we talk of formation of sex pili, I want more people to tell me we are talking with respect to conjugation. So let us have a look at conjugation, transduction and transformation. Starting with conjugation, very right, and you get questions on this. You get questions which is the first one, the green one. This is conjugation. What we see here is there is formation of sex pili. This is the recipient. So the donor passes the genetic material to the recipient by the formation of sex pili. This is conjugation. Versus transformation. Transformation बच्चे हवा में हो रही है. Easy way to remember, we guys, when somebody nice or partner enters our life, we get transformed. So transformation is हवा में. It is a process by which bacteria take up the DNA from their environment and incorporate it into their genome. So this is the bacterial cell wall, the chromosome, it entered into the recipient bacteria and got incorporated into the genome. So it is used to produce multiple copies of a DNA molecule. This is transformation. This is transformation. Somebody got transformed. That was in air. There is no direct contact. And lastly, this is transduction. This is transduction. In transduction, there is involvement of a bacteriophage. So phage injects the DNA into the bacteria. There is transfer of genetic material from one bacterium to another with the help of bacteriophage. This is horizontal gene transfer, and it is non-sexual movement of genetic information. Even transformation is non-sexual, but Nami, not from my place. I hope the noise is not severe enough कि I am not audible. थोड़ा सा let's compensate. Next session I'll take it from studio. I was feeling slightly lazy not to go to the studio today, dear. So three steps: conjugation, transduction, transformation. Transformation was in air, there was no contact. Conjugation, there was transfer with the help of sex pili. And transduction which involved phages, it was horizontal transfer. She was seriously thanks for the kind words, yeah. But yes, I'm slightly on the lazy side also. But coming back to this, Ada, thanks, yeah, seriously thanks. Next, so heat sensitive instruments are sterilized by. They are sterilized by. Because this was very commonsensical. When even you were sitting in the exam, you can, if it is heat sensitive, you cannot use hot air oven, autoclave or incineration. Obviously incineration is going to burn it. You cannot under any circumstance use those. So has to be glass plasma sterilization. Perfect. Nikesh बच्चे autoclave नहीं ना? Autoclave nahi, Nikesh, you deleted that. Fair enough. We never delete our wrong answers. Glass plasma sterilization. This is with respect to heat sterilization instruments, and it is a quick method of sterilization for sensitive surgical instruments. Next, bache, because of course, Nami, dear, we cannot. Incineration is burning. Matlab, you cannot burn your heat sensitive instrument. You cannot autoclave. Acha, tell me the parameters of autoclave. I'm waiting for the parameters of autoclave just because Nami has asked me this. If it is heat sensitive, we cannot obviously use autoclave, neither hot air oven. Tanvi, thanks, dear. Seriously, thanks. And I am looking forward to dal bati churma. Actually, Tanvi, from you. Let the paper get over and milne wale hain, no doubt. So, coming back to this. Those of you who are from Rajasthan, who are, I know she is Others, I love Rajasthan as a state, and it is their dal bati churma. It's very what do you call it? Time consuming to make, but extremely tasty. Agreed. Agreed, Pratik. Nami agreed. So, Nami, you knew the answer. 121 degrees for 15 minutes at 15 pounds per square inch, 15 psi. So, heat sensitive instruments cannot be treated that way. Agreed. Agreed. Next, straightforward question. Very straightforward. Most common cause of atypical mycobacterium in AIDS is MAC, Mycobacterium avium complex. It is MAC. Acha, tell me this with respect to complement. Let us do 2-3 questions here only. With respect to complement pathways, bacterial cell wall lysis is by. Keep on telling me the answers. Bacterial cell wall lysis is mediated by which complement? First question. Next, most common malignancy with AIDS. Let's have a quick look at AIDS. Most common malignancy associated with HIV. Next, most common 100%. Ada 100% here. It is not overrated. They कैसे बोल रही है? Oh. अब Ada, I do not know whether you are into non-veg or not, but I like tunde kebab types, no? Lucknow. But that was you said it with such an attitude, yeah. Coming back to this, yeah, YouTube, we will not get distracted. You guys always put me into gossip and this and that, and then I keep on getting calls from management कि sir, please, we have told you so many times YouTube पर gossip नहीं करना है. Seriously, Tanvi, awesome. Kashyap, which C5? It is a form, Pratik. Very well said. Yaar, you feel so sleepy after having dal bati. I mean, you have said it bang on right. I'm still waiting for the right answer, though. Thamari, no, your answer is not right. Tanvi, abhi, but you stay in Jodhpur if I'm not wrong. Ada. नहीं, I'll not say more on YouTube. मुझे आंसर बताओ. Most common malignancy, it's not Kaposi, बच्चे, it's not Kaposi. Bacterial cell wall lysis is MAC, membrane attack complex. यार, you guys, I love you, but you guys always land me into trouble, and I'm 100% going to get a call from management again today कि सर आप क्या क्या करते रहते हो ना YouTube पर आके. MAC, which C5, A or B? Yes, got me bang on. That was what I said also. I mean, same pinch. C5A or B? C5B to C9. C5B 6789. Most common malignancy, NHL. Non-Hodgkin's lymphoma. Nikesh, Kaposi nahi bache. Non-Hodgkin's got me and sort of a right. Ashad Gangadhar. Okay. NHL. Non-Hodgkin's lymphoma followed by Kaposi sarcoma. Next question. I always get a call, yeah, seriously. Next, and you do this with me only. Other sessions, you guys are so professional and stuff, but I love this. Kaposi sarcoma. It is, other than HIV, it is also associated with which viral infection? HHV8. So tell me the 3 diseases associated with HHV8, human herpes virus 8. So HHV8, recent NEET MBBS segment PYQ, it can easily be asked in your paper. HHV8, it is with 3 diseases. Which ones? Tooth talks, bache, consider the date of the paper as final. I am again saying this. In case the date gets postponed, it will not. But if it does, consider that time period as bonus. But at this point, you will have to consider the date as final. HHV8, Kaposi sarcoma, primary effusion lymphoma. Agreed. And Castleman disease. Primary effusion lymphoma and Castleman disease. Next, most common space occupying lesion in CNS in HIV. Last question. Most common SOL. SOL is space occupying lesion. Anything that occupies space. It can be infection, it can be cancer, it can be lymphoma. HIV increases the risk of all 3 in the CNS. It increases the risk of cancers, it increases the risk of lymphomas, and it also increases the risk of infections. But which is most common? Infection by toxoplasmosis. Most common space occupying lesion in CNS in HIV, toxoplasmosis. Next point. Next point. So these were the points with respect to HIV. You already know the most common cause of pneumonia in HIV, Pneumocystis jirovecii. Pratik agreed it was infection by toxoplasmosis. Pneumonia, recent MDS PYQ, Pneumocystis jirovecii. You know that. You know that. Most common fungal infection with HIV, Candida albicans. I need not even say that. Next. So this gets us to our next question. We discussed this in our session yesterday only, so I'm not even asking you this. Hospital, dry mouth, double vision, drooping eyelids, labored breathing and vomiting. With canned food, botulism. Very, very straightforward. We discussed botulism in detail yesterday. Next question. Next question. So, neonatal meningitis. Neonatal meningitis. Neonatal meningitis is most commonly caused by which pathogen? Tell me this. Botulism one was okay. Botulism one I 100% agree. Tell me with respect to neonatal meningitis. It is caused by Strep H. electae. Neonatal meningitis which is Strep H. electae. देखो हम लोग अच्छा tell me the classification of gram positive cocci also. Tell me the classification with respect to gram positive which is Strep H. electae. H. electae. देखो when we talk of Strep pyogenes that is group A. इसमें कश्यप नामी अदा थोड़ा सा गड़बड़ हुआ था अपना. When we talk with respect to Strep pyogenes which it is group A, beta hemolytic streptococci. It is group A. So tell me the classification of gram positive cocci. Gram positive cocci on the basis of catalase test. On the basis of catalase positive are staph, catalase negative are strep. Catalase positive staph on the basis of coagulase test. On the basis of coagulase positive is staph aureus versus coagulase negative, that is cons, coagulase negative staph, which are further divided on the basis of novobiocin antibiotic sensitivity testing. Novobiocin antibiotic sensitivity testing. Novobiocin sensitive, that is staph epidermidis, resistant staph saprophyticus. So easy NEET MBBS segment PYQ. Which of the following are coagulase negative staph? Answer was both staph epidermidis as well as staph saprophyticus. Now give me the right answer in one go in this. Staph epidermidis, that is cons, is associated with which infective endocarditis? Recent NEET MDS PYQ. Give me the right answer in one go. It is associated with which infective endocarditis? Next, coming to the other side, that is strep. On the basis of culture on blood agar, we can divide strep into alpha hemolysis, that is partial hemolysis, beta, that is complete, gamma, that is no hemolysis. Got me very right, very, very right. What do we mean by early prosthetic heart valve time period? Beta hemolytic streptococci. My next question to you is beta hemolytic streptococci. Prosthetic heart valve is okay. Subacute bacterial endocarditis, SABE, I agree. Subacute bacterial endocarditis has numerous causes. Staph epidermidis is in particular with early prosthetic heart valves. You were very right about SABE, bache. Very right about subacute bacterial endocarditis. But when you say SABE, got me not less than 12 hours. No, Pratik is right. That is less than 12 months, less than 1 year. Which is the most common organism associated with SABE? Subacute bacterial endocarditis. Most common organism. Most common, that is for you, Thamari, Nami, Satish and Nikesh. Most common organism with SABE being Strep viridans. Acute infective endocarditis, Staph aureus. Subacute infective endocarditis, Strep viridans. Strep viridans. Agreed. Next point, beta hemolytic streptococci. नहीं, Staph aureus is acute बच्चे. Staph aureus is acute. Subacute is Strep viridans. Coming to strep, beta hemolytic streptococci, beta hemolytic on the basis of carbohydrate C protein. What is the name of the classification scheme? Carbohydrate C protein. We use which classification? It has a name to it. And further, we subtype strep on the basis of M protein. Which is the main antigen in strep? It is the M protein. It is the M protein. Tell me the names of the classification. With carbohydrate C protein, the name of the classification being Lancefield classification. All these points are important. Lancefield, देखो इसमें C भी आ रहा है ना. Lancefield classification, carbohydrate C protein. M protein is Griffith typing. We classify it into type ABC. So group A beta hemolytic streptococci is associated with PSGN and RHD versus group B, which is associated with neonatal meningitis. Everybody, please give me a thumbs up if all of you are comfortable with all the points we have discussed till now. Give me a thumbs up, put a heart or like the video, anything, but so that I know that you are comfortable with the whole classification scheme and everything. Before we go further, tell me these two answers also. Group A beta hemolytic streptococci, they cause two diseases, PSGN and RHD. Tell me the hypersensitivity reactions associated. Tell me the hypersensitivities with both. 1, 2, 3, 4. Perfect. Perfect. Now tell me the hypersensitivities. See, PSGN post streptococcal. So what is the site of deposit in PSGN? Remember, it is antigen antibody immune complex deposit, which is getting deposited in subepithelial region. And on electron microscopy, it has a special name to it also called as humps. You know that it is associated with mild hypertension. To talk, yes, bache, it will. We will not be removing the session. It will be there on YouTube. PSGN is type 3 hypersensitivity. This is because there is antigen antibody immune complex deposit. Type 3. Whenever there is antigen antibody immune complex, it is type 3 hypersensitivity. RHD. What is the pathogenesis? Molecular mimicry. Molecular mimicry. That is what happens is, we guys know this well. There is, whenever RHD is seen in children, so child developed group A beta hemolytic streptococcal infection, his body produced antibodies against it. These antibodies, they cross reacted with host antigens. So the girl was angry on something but took out the anger on something else. Antibody mediated hypersensitivity type 2 molecular mimicry. We know this very well. Very, very well. Agreed. First class. So another way to remember or a mnemonic to remember is कि दो हैं, इसमें 4 alphabets type 3 hypersensitivity, 3 alphabets type 2 hypersensitivity. Number of alphabets -1. You can remember it anyway, but this is asked. Next question. Next question. फटाफट से let's come back to the next one. RHD 5 नहीं बचे, 5 नहीं. Ria, type 5 hypersensitivity is only with 2 diseases, na dear? That is Graves disease and myasthenia gravis. You know that. We covered it yesterday, na bache? Next, what is the name of the test? This is Elix gel precipitation test. This is where you are able to clearly see the presence of a line of precipitate between toxin and antitoxin. Elix gel precipitation test, which is used for Corynebacterium diphtheria. Corynebacterium diphtheria. Fair enough. Next question. I'm pretty sure that everybody would have been okay with it. Now this is tricky, and this is one of my favorite questions also. Tell me 2 questions in this. Least concentration of HIV. First question. Second question, the major blood group system is ABO blood group. Least concentration of antigen. Least concentration of antigen of ABO system. देखो ABO system antigens. ABO system for Gitanjali. बच्चे you tell me. Corynebacterium diphtheria. Ria, I know dear. कोई बात नहीं ना. That is why we are doing this. So Gitanjali, this is for you dear. Corynebacterium diphtheria, the culture medium. So tell me 2 answers. First, tell me which is the fastest culture medium for Corynebacterium diphtheria. Next, most specific. I want you guys to tell me this. Everybody. I'm waiting for your answer on this, and then we come back to this question. HIV, the least concentration is in saliva. HIV is there everywhere. It is in saliva, CSF, blood, semen. Least is in saliva. This does not mean let's go and kiss. Not at all. Not at all. And no double meanings to this. Least concentration of HIV saliva. Least concentration of ABO system antigen. ABO antigens, they are again secreted everywhere. Saliva, CSF, blood, semen, milk, sweat, gastric juices. They are secreted everywhere. Where is the least concentration? LSS is fast. I agree. Corynebacterium diphtheria, Loeffler's serum slope is fast. Which is most specific? Tell me specific. Gitanjali, this was for you, dear. Least concentration of antigen in ABO system, which is this is in CSF. So when the question is asked, do not get confused between these two options also. HIV, least is saliva. Antigen of ABO system, least is CSF. Two important points. Got me agreed here. Fastest, Gitanjali, which is LSS, Loeffler's serum slope. Most specific being potassium tellurite agar. Most specific being potassium. Let me write this completely for you. Potassium tellurite agar. These are simple, straightforward points usually asked in the paper. First class. Next question. Which of these is irritant? हाँ, agreed. they खुद ही question पूछ के खुद ही answer दे रही है. वाह. Next point. So which of these is irritating for skin, so it is not used as a disinfectant? That is hypochlorite. This is just a fact, has to be remembered. This hypochlorite destroys, but it is irritant to the skin. I'm not even asking you this. Type 1 hypersensitivity, IgE. Next, tell me this. Agreed. The previous two questions. Path microbiology, sometimes the questions are so simple and straightforward. Hypochlorite, Naveen Twiche, hypochlorite, cyclopropane, hypochlorite. Come to this. Not true about IgG. Let me slightly increase this so that 25. Which come to 25. Not true about IgG is. Acha, do you have the concept of RH incompatibility? एक बार please tell me this. With respect to mother and the child, do you have the concept of RH incompatibility? Yes, no? Yeah, I'll say this to you. एक बार just listen to this. If the mother is RH negative and the child in her body, when it is in the womb, child is RH positive, the first child. When delivery occurs, during labor, there is exchange of blood between mother and the child. The fetal blood goes into the mother. So the mother's body produces anti-RH antibody. Anti-RH antibody is IgG type of antibody. It crosses placenta. So when this lady gets pregnant the second time, she is RH negative, but suppose her second baby is again RH positive. The mother has anti-RH antibody which now crosses the placenta and damages the child. This is the concept of RH incompatibility. It is which hypersensitivity? It is antibody mediated hypersensitivity, that is type 2. So we have to be very, very conscious during the first delivery that anti-RH antibody do not develop in the mother whose baby was RH positive. There is no problem for the first child. Perfect now. Agreed. So how many of you are single kids? I mean, I'm a single kid, so there is no problem usually for the first child. First child is always the more pampered of the lot also. Second kid thoda sa hota hai, I think. I don't know. I do not have siblings, so no idea. Next, so not true about IgG. Most common immunoglobulin, when this was the exact question, examiner had just written GCF. They did not tell you it is gingival clavicular fluid. I don't even know what this means. So am I those. So when this question came in the paper, then also confused to hona hi nahi hai. See, in the paper, our target is not to show that we worked hard. It is not to show that we have not lots of knowledge, not at all. I strongly believe that if you mark the MCQ right, you know everything about the topic, otherwise it does not matter. I'm very blunt with respect to that. So even if you were not aware in the paper what GCF stands for, IgG is the most common immunoglobulin in the body, so it has maximum concentration GCF. Fair enough. Let's go to the next one. It is the warm type. Cold type of immunoglobulin is IgM. Cold bache is IgM, warm type is IgG. Primary immune response is by IgM. Oh my god! I'm not even going to pull your leg on this, Aparajita. At least क्या जल्दी थी ना बेबी, मतलब come on, oh my god. Okay, so coming back to this, coming back, but I'll certainly pull your leg when we meet on Zoom session. Next point, blood transfusion reaction is ABO incompatibility. I am not even going to ask you this. Next, which of the following is anti-apoptotic? Nami, matlab, it is Nami. It's not only about kid. It's not only about time. I guess you have to take care of logistics also, na? Because she's studying side by side. हिम्मत नहीं बचती है. Yeah, why do I end up saying shit like this? Oh my god. And then, as Truth Talks asked me, because of such statements, which we need to remove YouTube sessions sometimes. Which is anti-apoptotic. Any protein with L in it is anti-apoptotic, except BCL excess. Except BCL excess. So any protein with L is anti-apoptotic except BCL excess, which is pro-apoptotic. Fair enough. Tell me about MIC. Tell me about MIC. MIC, this is very important. MIC is proto-oncogene. MIC proto-oncogene mutations. There are three types of MIC: CMIC, NMIC, LMIC. CMIC is associated with Burkitt's lymphoma. CMIC, Burkitt's. N for which tumor? Neuroblastoma. L, which organ? Lung. Small cell carcinoma, lung. So CMIC, Burkitt's, translocation, small cell carcinoma, lung. Burkitt's lymphoma, translocation, 814. Acha, tell me 3-4 translocations. Now that we are doing translocations, last two topics before we finish off our today's session. Translocations and types of collagen. Burkitt's lymphoma, you have already told me, translocation 814. Best prognostic AML. AML M3. Best prognostic AML, also called as acute promyelocytic leukemia. Translocation. Next, you have a history of an adult with high TLC. TLC is 80,000 per microliter, with presence of all the cells: blast, promyelocyte, myelocyte, metamyelocyte, with basophilia and splenomegaly. With basophilia and hepatosplenomegaly. Translocation. Philadelphia chromosome, I agree. Tell me the name of the translocation and the protein formed. Next, follicular lymphoma, mantle cell lymphoma. Just these 5. Mantle cell lymphoma, translocation and proteins. AML M3, translocation 15-17. Adult with high TLC with basophilia and hepatosplenomegaly. When basophils are increased, it is CML. Chronic myeloid leukemia, CML. Philadelphia chromosome, translocation 922. Whenever translocation occurs, sort of bang on right those, whenever translocation occurs, it leads to the formation of a protein. What is the name of that? BCR-ABL. Again important, it is opposite. BCR is on 22, ABL is on 9. देखो बच्चे, all of us, we have proteins BCR and ABL in our chromosomes. Normally in us, BCR is on chromosome 22, ABL is on 9. They are separate. They are living happily separately. It is when they come together, when translocation occurs, when they come together, they lead to the formation of a protein, BCR-ABL, which leads to blood cancer, CML, chronic myeloid leukemia. Follicular lymphoma, translocation 1418. Which protein? It is BCL2 positive. Versus mantle cell lymphoma, translocation 1114, there are two proteins. It is BCL1 and cyclin D1 positive. This was the master table with respect to translocations and the proteins associated. And lastly, tell me about types of collagen also. We keep this as our last topic for this session, collagens. Most common collagen in the body. Most common collagen in the body. Keep on telling me the answers. Next question, most common collagen seen in bone. Next, most common in cartilage. Most common collagen seen in cartilage. Next, most common collagen seen in placenta. Next, which is the fine collagen? Fine collagen is the one which is present in basement membrane. No, it is not 1, 2, 3, 4, 5, 6, 7. I have not written the questions in that sequence. Most common is type 1 collagen. Agreed. Which is present in skin, bone and cornea. Type 1. Cartilage is type 2. Cartilage, the name itself tells you, cartilage type 2. Placenta. Whatever you do in life, don't have more than 5 affairs. Just a way to remember. I'm sure the pretty girls out there would have crossed the number 5. Placenta type 5. Which is the fine collagen? That is basement membrane type 4. This was last question. Placenta 5 bache 5. Married people do not even talk about affairs. So Aprajita, if you don't know about it, it's perfectly okay. Type 5. And lastly, which collagen plays a role in wound healing? Which is the first step of wound healing? Formation of granulation tissue. That is type 3 collagen. Nahi bache, Naveen, no. Type 7 collagen is the facet collagen. It is associated with collagen interactions. Not interested. Naveen, not interested. We keep ourselves to type 1 to type 5. Perfect. So this takes care of our 2 miscellaneous topics also today, that is translocations and collagens. Sufficient bache, sufficient. We covered a lot of content, lot of content in this session. Absolutely no doubt about this. So yes, 3 followed by 1 because granulation tissue is 3. Which was the firm collagen? 1 because it was present in bone. So when scarring occurs, type 3 collagen is replaced by type 1. Perfect. Aprajita sort of got me. Agreed. Perfect. So this takes care of our today's session, and we'll do the 2 hours that we'll meet. We'll obviously not 2 hours type. We'll first have a look at path, followed by micro. We'll do it MCQ wise. We'll cover more content, and this is the pattern we'll follow. So needless to say, guys, it's always a pleasure interacting with you all. Take care, and good night. Thank you, guys. Take care. And those of you who have not taken dinner, please do have well-deserved dinner. Take care, Vijay. Bye-bye.